Our presentation is on the vulnerable population, veterans with mental illness, presented by Elizabeth Ross, Linda Feller, and Deborah Jones, currently at the University of Sioux Falls, South Dakota in the nursing department. The United States military personnel are committed to serving and protecting the public. Although those who serve are known as heroes and often seem invincible, many of our country's veterans are at risk for or currently have chronic diseases. After coming home from war, many soldiers face physical, mental, and social issues that make them a vulnerable population. There are several reasons why veterans are at risk of being a vulnerable population. For our purposes for this paper, we will focus on veterans with mental illness. Common mental health problems among the veteran population include traumatic stress disorder, traumatic brain injury, depression, anxiety, and substance abuse disorders. Through the research concerning the vulnerable population of U.S. veterans with mental illness and discussion with key informants working with veterans returning from deployment, the following health needs were explored: education of veterans, their families, and the community they serve in understanding mental illness and its treatment to reduce stigma. Collaboration of community efforts and resources to increase awareness of treatment and support available for veterans with mental health problems. And lastly, ensuring access to appropriate quality mental health services by reducing barriers to treatment. Some of the resources available to this vulnerable group are programs through the Veterans Administration, local public health department counseling and referrals, and veteran support groups through churches, community action groups, and mental health associations. The goal of this project is to increase awareness of veterans with mental illness as an underserved population and to enhance the reader's knowledge and understanding of their need for treatment and services. The research that we reviewed led us to the nursing diagnosis, risk for inadequate treatment among mentally ill veterans related to stigma and barriers to mental health treatment, as evidenced by current data that estimates up to 50% of veterans with mental illness remain untreated. Vulnerable veteran populations defined. After coming home from war, many soldiers face physical, mental, and social issues that make them a vulnerable population. Some of these issues include, but are not limited to, brain damage, depression, post-traumatic stress disorder, anxiety, substance abuse, loss of limbs, homelessness, unemployment, family and interpersonal problems, and trouble adjusting to civilian life. All of the above issues can contribute to a veteran having mental health issues. As you can see, not all wounds are visible. Determinants of health include gender, ethnicity, race, socioeconomic status, education, marital status, physical health status, and social support. Healthy People 2020 has identified veterans who have experienced physical and mental trauma as a special population with emerging new mental health issues. One goal of Healthy People 2020 is to improve mental health through prevention and by ensuring access to appropriate quality mental health services. If you take a look at this poster here, you can see that PTSD affects a significant percentage of our nation's veterans. Approximately 15% of the veterans are currently diagnosed with PTSD, and that is estimated that approximately 30% will experience PTSD in their lifetimes. Removing the stigma of seeking mental health care will help save veterans' lives. Getting help does matter. Treatment does work. Biology and behavior of the veterans with mental illness. Many factors can contribute to the onset of mental illness. Anyone can potentially develop mental illness under the right circumstances. Veterans have an increased occurrence of mental illness than the general population does. Research studies have found that certain biological, environmental, and psychosocial factors make it more likely that service members will develop mental health problems. These include long deployment time, severe combat exposure. This would include being deployed to forward areas close to the enemy, and also would include seeing their fellow soldiers wounded or killed. More severe physical injury, traumatic brain injury, lower rank, lower level of schooling, low morale and poor social support within the unit, not being married, family problems, being a member of the National Guard or Reserves, having a prior trauma exposure, being of the female gender, and Hispanic ethnic group. Behaviors which are most common to this population include difficulty concentrating, lack of interest, apathy, feelings of detachment, loss of appetite, hypervigilance, exaggerated startle response, and sleep disturbances, which would include lack of sleep and oversleeping. Social and physical environment of veterans. Most military personnel reside at military bases where life is very structured. The military base community is similar to small town living. Everyone knows everyone else. The military hierarchy includes officers to enlisted personnel. Troops are trained to do what they're told, obey orders, don't ask questions, be strong both mentally and physically. Their lifestyle includes risk of service member injury or death, frequent relocations, periodic separations from family, living in a foreign residence. Honor, courage, and commitment encompass the military life. Mental toughness is a highly valued trait in the military. As I stated previously, only half of the veterans experiencing mental health issues seek help. A veteran may feel embarrassed or ashamed of having mental issues, such as the PTSD, depression, and anxiety. Studies have also investigated the role of personal beliefs about mental illness and treatment. In one study, personnel experiencing symptoms found that soldiers felt they should handle the problems themselves, that they were not ready to talk about their problems, and that they did not want to make a big deal out of their symptoms. Research indicates that stigma and lack of understanding contribute to the avoidance of getting help. Soldiers may believe that seeking treatment from a mental health professional will lead other soldiers to view them as weak and incapable of handling their own problems, and that their commanders will view and rate them differently. These concerns are likely to be elevated in the military environment due to the fact that commanding officers have access to service members' mental health records. And service members who are seen as unfit for service can be discharged and removed from duty. So it is not surprising that approximately 19 to 44% of soldiers returning from Afghanistan and Iraq meet current criteria for diagnosis of mental health disorders, and that approximately half of those individuals did not seek mental health services, and also that most soldiers do not pursue follow-up care after their initial referral to mental health treatment. Collaboration. An action plan to better serve this population includes resiliency training, shifting the culture to reduce stigmas, and limiting or mitigating exposure to combat stressors and trauma. Primary interventions include comprehensive airman and soldier fitness training, education and awareness training regarding mental health for military leadership, members' families, and communities, and limiting exposure to combat. Secondary interventions would include social, medical, and mental health care and treatment while deployed, and integrated primary care and mental health clinics stateside. Tertiary interventions would include breaking down barriers to care to promote long-term care among veterans. This includes facilitating transportation, working around schedules, and allowing flexibility for veterans to seek treatment. Key stakeholders would include military leaders, military members, veterans, mental health providers, nurses, primary care providers, master resiliency trainers, civilian bosses, co-workers, directors of psychological health, and chaplains also. In conclusion, the mental health of military veterans will continue to be of concern for the nation as we continue to send military members overseas to combat. Until there is a shift in the culture of mental toughness and more education and awareness on the reality of mental health, veterans will continue to be at risk for inadequate mental health treatment related to barriers to seeking help. In order to overcome these perceived and real barriers, collaboration will need to continue to occur at every level of the military and within the healthcare systems utilized, such as the VA. Evaluation and implementation of the interventions mentioned in this paper should lead to more veterans seeking and continuing their mental health care. Future needs of mental health care for veterans will continue, especially as combat continues. As the last 10 years continue to be evaluated and more data on successes and failures come to light based on research, hopefully the U.S. becomes even better equipped to handle the mental health of its military members so that less mental health care is needed for its veterans.